got cold sores all over my lips. Going to get out of bed, I couldn't use either of my legs properly.
The likely culprit? Chicken. The government knows something about your chicken, but it's decided not to tell you, or not just yet. Over 250,000 people in the UK are poisoned every year by a bug called Campylobacter, and the majority of infections are caused by contaminated chicken. We eat more than 1 million tonnes of poultry a year. But Campylobacter also loves chicken. The government's own tests show that 2/3 of fresh poultry is contaminated with the bug. You can kill it with thorough cooking, but it's easy to spread from raw meat.
Campylobacter is really important. We know it's the most serious and most impactful foodborne disease. So there are over 280,000 cases each year in the UK. Many of those lead to GP referrals. Many people have to go to hospital. We know that some people suffer serious long-term complications, and very unfortunately, some people die. And we also know that the majority of those cases can be linked back to poultry.
If you wonder why all these hygiene rules matter, ask Julie Wilson. A nurse from London, she's got all too direct experience of Campylobacter. For some, the bug means a few days off work with diarrhoea and vomiting, but not for Julie.
I wasn't bouncing back. I still, even when I began to be able to eat a little bit, didn't feel better. And then I got cold sores all over my lips. It wasn't till the following day, when going to get out of bed, I couldn't use either of my legs properly.
Julie had developed Guillain-Barré syndrome, an autoimmune disease that's a rare complication of Campylobacter.
I lead as normal a life as possible. I'm as independent as I can be, but I am not back to normal at all, and probably will not be ever.
Let's start with what a zoonotic disease is. As Jackie mentioned, these are diseases that are transmissible from animals to humans and vice versa. And some of these are borne by poultry species. There are over 200 zoonotic diseases worldwide, and these diseases include, or pathogenic agents that cause these diseases include bacteria, parasites, viruses, and fungi, among other things. And about 70% of emerging and re-emerging infections are vector-borne or zoonotic, and that is not known to many people. In fact, we encounter these diseases quite a bit, not knowing that they are circulating worldwide in many parts of the US as well.
We know that chicken can carry nasty bugs, Salmonella, E. coli, Campylobacter. But now those common stomach bugs are turning into superbugs, meaning antibiotics can't kill them. Doctors here have tried antibiotic after antibiotic.
What's that like, to have a patient come in and there's nothing left in your arsenal to help them?
Feel desperate, horrified, that I'm not able to do what I was supposed to.
So it's okay?
Dr. Yazdan Mirzanajad started this clinic. Patients here have picked up a superbug. Oral antibiotics won't work for their infections.
Abscesses, cellulitis, bursitis, you name it, kidney infection. We deal with all of them here.
More and more antibiotic-resistant infections, or superbugs, come from bacteria on your food, like the kind found on supermarket chicken. I've looked at the list of antibiotics. 11 of them don't work on you.
No, that's what they say.
No one knows for sure how Brown got her antibiotic-resistant bug, but new research reveals an E. coli bug causing severe infections like Brown's can now be found on supermarket chicken.
As long as we continue to do antibiotics feeding to the livestock, that is going to happen and it's going to get worse.
That's right. Overuse of antibiotics on farm animals is one of the major reasons antibiotics are failing us.
I think the era of antibiotics therapy is very close to be over.
So you think the day is coming when antibiotics will just stop working?
Absolutely, I have no doubt.
Just going over this list, it might seem a little bit overwhelming, but really some of these listed here that are not in red are not as common as the ones that I will discuss that are highlighted in red, like Newcastle disease, avian influenza, Salmonella, Campylobacter, erysipelas, avian tuberculosis, and avian chlamydiosis. As you can see here, for example, Newcastle disease manifests itself mainly as a form of conjunctivitis or eye irritation or redness, and transmitted mainly through poultry vaccines or laboratory accidents. Whereas avian influenza, on the contrary, which is also an economically important poultry disease, can cause not only conjunctivitis and fever, but pneumonia and death in poultry, in humans, or both poultry and humans.
Farmers give animals like chickens the same kind of drugs we need to get better in their feed, in their water. Antibiotics like amoxicillin, tetracycline, erythromycin, and ceftiofur. Not just when animals are sick, they can give them every day to prevent disease and to make them grow bigger, faster.
The analogy for humans would be that every morning when you wake up and you have your breakfast cereal, you pour in a healthy dose of antibiotics, whether you're sick or not. And we wouldn't do that as humans. Doctors wouldn't prescribe that for humans, but that's what's going on with our food animals.
Overuse makes the bacteria on meat resistant to antibiotics. They become superbacteria or superbugs. That's what we're looking for in our test. We picked chicken because it's the most popular meat in Canada. We buy 100 samples, snap them, label them, and ship them to a lab for analysis.
Let's just review avian influenza for a minute. I know some of you know so much about this influenza virus already. It is, of course, a type A strain of the influenza virus. It is an orthomyxovirus. It's the same type of virus that actually causes the regular seasonal human flu. And there are two types in terms of clinical manifestations of avian influenza in domestic poultry. The low pathogenic avian influenza, or LPAI, causes mild or no clinical signs in some cases. Sometimes it's just a very mild conjunctivitis and facial swelling, as you can see here on the top picture. Low to moderate mortality. Sometimes you can't even notice that anything's going on in a flock of chickens or turkeys until all of a sudden you'll see a progressive drop in production. Then you get suspicious. And some of them, of course, have some nasal discharge and respiratory difficulty later on. Now, the low pathogenic H5 and H7 strains are the most commonly associated with mutations into highly pathogenic strains. And when they become highly pathogenic, this is what happens. Very, very severe clinical signs and lesions, along with very high mortality, sometimes reaching as high as 100%. It can decimate an entire flock of chickens and turkeys. But in humans, when they get infected with avian influenza, particularly the highly pathogenic type, for example, the H5N1 highly pathogenic type, it is very similar to the seasonal human flu, like coughing, fever, sore throat, muscle aches, headaches, and shortness of breath. So you might suspect that you just have the regular human flu, when in fact you have the bird flu.
I'm a pretty healthy guy. I'm in good shape. I exercise and I do all the right things. And this hit me really hard.
Jerry Wright was sick for months on IV antibiotics.
Even though you were faithfully taking the antibiotics as prescribed, you still weren't getting better.
That's right. I guess about 24 hours after I was at the hospital, they called me up to tell me, oh, guess what, that you have salmonella growing in your bloodstream, and this is why you're so sick.
How serious is that?
Well, you can die from sepsis. So death is the worst case scenario.
Luckily, another more powerful antibiotic the doctors tried kicked in. Turns out, Wright had been infected by one of these new superbugs.
After you.
Wright's not your average food poisoning victim.
Grab one of these?
Yes.
He's also head of infectious disease research at McMaster University.
This was in your bloodstream.
This was living inside of me, yes.
Wright says drug companies aren't making new antibiotics because they take years to develop and aren't the money makers other drugs can be.
It's the bugs against the drugs, and the bugs are winning.
So if the bugs are winning and we're running out of antibiotics, why does that matter?
It means we go back to what it was like pre-1930, when the largest cause of death was infectious diseases caused mostly by bacteria.
The major outbreaks of highly pathogenic influenza in humans actually, as I said earlier, occurred first in Hong Kong in 1997. This was highly pathogenic H5N1 that infected both chickens and humans. At that time, 18 people got sick, and six of those people died. So that's a 33% mortality rate. This was the first demonstrated case of a spread of avian influenza from chickens to humans. Now, they thought they had everything under control. In fact, they depopulated the entire live bird market system in Hong Kong and pretty much put things under control. But in 2003, China and Hong Kong experienced the same outbreak of avian influenza H5N1. And this first occurred among members of a family from Hong Kong that had traveled to visit relatives in mainland China. One of those people in that family recovered and another one died. And this type of virus has been circulating in about, I'd say, 14, 15 countries in Asia, the Middle East, and some parts of Africa since 2003.
In the U.S., experts estimate up to 70% of all antibiotics are fed to healthy livestock.
Are there any limits to how many antibiotics chicken farmers can use?
You know, our position is judicious use. From a farmer perspective, a farmer isn't going to use more than they think is necessary.
But they could use as much as they want. There's no quota.
There's no limit in what they could in terms of maintaining the health of that flock.
Dungate says farmers don't need limits.
Doctors, scientists, researchers, they say the solution is clear. Chicken farmers need to stop using the level of antibiotics they're using today. Otherwise, they predict the day will come when antibiotics will no longer work for people.
Mm-hmm. I think we would be concerned about that, but we would also be concerned that we can't use those antibiotics ourselves in chicken production.
But human health must trump chicken farming. I mean, we don't want to go back to the days when if you get pneumonia, you die because we have no antibiotics.
Absolutely. Absolutely.
But researchers say that's where we're headed. There's a huge overuse of antibiotics in poultry farming.
I don't believe there's a huge overuse.
A little bit more like a rare type of poultry disease that may cause infection in humans or disease in humans is avian tuberculosis. You know the dreaded tuberculosis in the old days killed a lot of humans when there were no antibiotics available. I guess these days there's still some circulating in the human populations, particularly in developing countries. But avian tuberculosis is caused by a very specific mycobacterium, which is Mycobacterium avium. And it's pretty prevalent in captive birds rather than free-living wild birds. So it's a chronic wasting disease. And some birds may just show lameness. If these chickens die and you open them up, you'll see some granulomas in the liver, some nodules, also in the spleen, bone marrow, and intestinal tract. And you might mistake this for Marek's disease because unless you do some diagnostic testing, bacterial isolation and histopathology, you will not really know what is going on or what's causing the disease. But this is just an example of what happens when a chicken or turkey is infected with avian tuberculosis. But in humans, it's really not a systemic disease, just like unlike human tuberculosis. What you'll see are just skin lesions here. Local wound infections, swelling of the lymph nodes in some cases. So it's extremely rare, and it usually infects people whose immune systems are compromised. For example, AIDS patients and people with diabetes.
We're testing supermarket chicken for superbugs. Get infected by one of those bugs, the usual antibiotics won't work. Dr. Yazdan Mirzanajad is running out of options.
Sounds pretty grim in your field of infectious diseases.
And I'm usually a very optimistic person, but I am somewhat horrified.
What do we find? 2/3 have bugs: E. coli, Salmonella, Campylobacter. But the key question, how many of those bugs are antibiotic resistant? All of them, to at least one antibiotic. All are no longer your regular stomach bugs. All have mutated into superbugs.
Every single bug that we found was resistant to at least one, and a lot of them were resistant to a number of antibiotics.
It really needs to be seen as an impending crisis. Your data just support.
So you would go so far as to say we're nearing crisis levels here?
Absolutely. We now have organisms that are completely resistant to every antibiotic that we have available to give to them.
And our most disturbing test result? One of the most crucial antibiotics we have is Ceftiofur. It's the only antibiotic doctors can safely use to treat food poisoning in pregnant women and children. Almost half of the Salmonella bugs we find are resistant to Ceftiofur.
Zoonotic diseases from poultry products. I guess this is more common and I guess more interesting for us, because if you've ever had or have ever experienced any of these diseases, then you will know through your own experience how nasty they can be. Salmonellosis and Campylobacteriosis are foodborne pathogens. Bacteria, but there are various strains of Salmonella, as you know. In this case, we have host-specific and non-host-specific Salmonella. Host-specific infections are caused by Salmonella pullorum, also known as pullorum disease, which has been eradicated here in the U.S., and Salmonella gallinarum, which causes fowl typhoid. Now, those non-host-specific infections are probably the ones we should be concerned with more than the host-specific infections. These are the ones caused by Salmonella enteritidis and Salmonella typhimurium. For example, Salmonella enteritidis and typhimurium cause these dreaded Salmonella food poisoning in humans. Foodborne outbreaks that cause severe diarrhea, and it's pretty inconvenient if you get infected with these types of Salmonella. And they come from these infected or contaminated eggs and other poultry products.
None of this is a surprise to our federal government. It's been testing supermarket chicken too for the past 10 years, also finding superbugs and publishing this study showing there's a strong link to human health.
Chicken farmers say they need antibiotics to promote chicken growth, to keep the chickens healthy.
Sure. So I would say if chickens are sick, then chickens deserve to get antibiotics. If chickens are not sick, then there's no reason to do that.
Let's move on to the paratyphoid Salmonellas. It is really severe when it gets to your system. It results in really severe diarrhea, fever, and abdominal cramps. And cases of food poisoning can sometimes be deadly. There are also some Salmonella infections that become systemic that result in multiple organ failure, and people can die from Salmonella. And I'm sure you've read in the papers, you've seen in TV, some of these Salmonella outbreaks that have sickened or killed some people, and they were traced to some contaminated poultry products.
This sample had antibiotic resistance to 8 antibiotics.
Okay.
8. What do you think of those numbers?
In terms of those numbers,
Yeah.
you know, this is our point here, is that there is Salmonella bacteria on chicken.
But worse
All right.
than Salmonella, there's now antibiotic-resistant Salmonella.
Right. And
Resistant to 8 antibiotics.
and we've got a safe, nutritious product.
But do you need to use the key frontline antibiotics, the antibiotics used for pregnant women and for children?
Campylobacter, another foodborne bacterial infection, though not as common as your salmonella infections. They're caused primarily by Campylobacter jejuni. They come mainly from backyard poultry and companion animals that are experiencing diarrhea. That would be your dogs and cats, mostly puppies. And of course, contaminated drinking water. That can also be a source of Campylobacter infection. In poultry, well, Campylobacter pretty much is a kind of a regular resident of the gut. So it's like a normal gut microflora. So you won't really see clinical signs that much. And the problem is when this gets to people, when you ingest it through contaminated poultry products, then it's like a salmonella type of disease where there's diarrhea, sometimes bloody. There's fever and abdominal cramps, accompanied by nausea and vomiting. Usually the symptoms occur within 2 to 5 days after exposure and last for about a week. And people get really sick and dehydrated, and they end up being confined in a hospital and have to be given IV fluids and antibiotics.
We're testing supermarket chicken, looking for super bugs that can make antibiotics fail. We're about to reveal what's on that pricey poultry raised without antibiotics.
We found antibiotic resistance, even on the antibiotic-free chicken.
Wow, really?
In fact, we found some chicken that was resistant to as many as 5 antibiotics, even though it was supposedly raised antibiotic-free.
That's a serious downer.
And organic? Hard to believe. We find E. coli resistance to 4 antibiotics. Not as bad as some of the conventional brands, but still troubling. We tell Damien Girard there are superbugs on his organic chicken.
I was quite surprised on that because we're not putting any antibiotics on our chickens.
Because they don't get antibiotics, his chicks take 10 weeks to grow. Conventional chickens, only 5 weeks.
I think that organic way is the best way to do it. I'm proud of it.
And get this, how he thinks antibiotic-resistant bugs can end up on organic chicken.
We're buying conventional chicks because we don't have any organic chicks on the market. So we're buying conventional chicks that have some antibiotics on the eggs. Maybe the resistance are beginning in the eggs. I don't know.
Who knew? Some organic chicken comes from eggs that get injected with antibiotics at the hatchery.
For 22 years, Craig Watts has been a factory chicken farmer for Purdue.
And I'm no danger of losing the farm now either. I mean, I'm in a better position than a lot of people to talk.
Yeah.
I mean, I'm not. If I was $1 million in debt, would I be so vocal? I don't know.
Yeah.
I don't know. Is this an effective silencer? I mean, this thing has been done behind such a veil of secrecy for so long.
Yeah.
I call it behind the iron curtain farming. That's where we are. I mean, you've seen the reaction when I open my doors.
Yeah. Yeah.
That should be not a problem.
No, it shouldn't.
I should be able to, very comfortable taking anybody down there I want.
Yeah.
And I am. You make up your mind, here it is. But they don't want you seeing that.
No.
Because that's not that red barn and white picket fence that's on that label.
No.
All natural. What the heck does that mean?
They have control over the market. They have control over the distribution, and they have the control over bringing you the chickens, but they don't actually raise the chickens.
No, but they have control over it. But they have and they have all the rights, but they don't have any responsibilities. That's a good position to be in. Oh, well, the USDA process verification label that's on the chicken that they're touting in their commercials, cage-free. You'll see all this when you get down here. Humanely raised, no steroids or hormones, all natural. I actually saw a label the other day that said gluten-free.
No.
I did not know that was an issue, but I'm not kidding. So any trend that they can capitalize on and try to make them in on, they're jumping on it. And
so what's happening is they're using the marketing terms so they can appeal to a broader customer base, right, and continue to sell chickens. But at the same time, you're not seeing any different profit. And the policies, at the end of the day, aren't changing. Nothing's changing. It's business as usual.
The logistics have not changed. The only thing that has changed is image has gotten further away from reality.
Marek's disease virus, which is a herpes virus of chickens, it's a very big deal in the poultry industry. It used to be a very benign disease, so in the 1950s it did not cause much harm to chicken. These days, the strains that circulate kill all unvaccinated birds in 10 days. Now, what caused that? One possibility is that it was the vaccinations used in the industry to protect the birds against those diseases. And so we had this idea that evolution like this could happen, that vaccines could drive more pathogenic strains. So we became very interested in testing that, and we've done that experimentally now. And what we find is that indeed these super hot strains, these ones that kill everything in 10 days, that is not enough for transmission. So if they kill everything in 10 days, that's the end of them. If you keep them alive, the birds alive with vaccines, those strains now can transmit because their hosts don't die. And we found precisely what we predicted.
They'll go about 38 days. They're 4 weeks right now. Now see this bird right here? Yeah. Is it okay if I show you how to properly euthanize one? Are you okay with that? Or I don't want to flip you out.
I need to see it. So when you come in...
This is what I look for. I mean, he can't stand. I mean, you see he's fell off. He's not near as big as the other. Can't reach the feeding water. The joints are screwed up. That's a genetic thing. If I had a little X-Acto knife, I could cut there, and there would be some infection there, some pus.
Yeah.
Sure. And sometimes you can hold them up, and I mean, they'll be like this big around. I don't think the animal welfare folks act exactly like the method that the Chicken Council. You understand the animal welfare standards are written by the National Chicken Council.
Yeah.
Who are lobbyists for the industry.
Exactly.
So they're not that hard to adhere to. But this is what they say they do. That look humane. That look humane. But they say that doesn't hurt him. I don't know. It's hard for me to say.
And that's your job. You have to come in and...
I pick up the trash and clean up the trash.
You pick up the trash.
Yeah.
It's not like feeding the chickens and moving them around.
The job is getting the trash out, getting the dead up and getting their trash out. They own the chicken until he dies, then he's mine. They own the feed till he poops it out, then that's mine.
They don't look like the chickens I remember growing up around.
That bird is designed to put on meat. He's not designed to put on feathers. This is the reality. This is not the image. I mean, you're in here for 5 minutes. That chicken's in here for 24/7, 365.
Yeah.
And you know what you're sucking in, and he's close, lower to the ground. I never understood that phrase cheap meat. Compared to what? No. What are you comparing it to? There's nothing else out here. 95% of the chickens, this is it.
This is it.
Yeah. But they don't mind putting that label on there and jacking that price up. So where's this concern for the affordable food supply anymore when they put no antibiotics on it? And you know, no antibiotics doesn't mean no drugs.
Yeah.
Okay, most of the people think it's drug-free. They think no antibiotics, organic, da-da-da-da-da. Yeah. No. These birds couldn't survive in this environment without something.
Yeah.
They couldn't.
So what are the implications of this? Well, first off, there's a very real question of whether in the chicken industry, Marek's disease virus itself is going to get even nastier. The second question is, does this have any implications for other diseases in agriculture? And I think it does. There are quite a few things that are vaccinated against where the vaccines are of these leaky types. The one that particularly concerns me is avian influenza. So avian influenza can come in very high pathogenic strains, and those ones are of deep concern to industry all over the world. In the US and in Europe, the birds that get avian influenza are culled. So there's no evolution because everything's dead. But in Southeast Asia, they vaccinate and the vaccines leak. So this sort of evolution could happen with avian influenza. And I think that's a very real concern